Hello all my nursing people, it's Liz. Welcome back to my channel. Today we're going to talk all about the nursing brain and the report sheet. Something that I've had so many student nurses and people I've precepted and just new nurses ask, how on earth do I keep track of this chaos? When you have 5 or so patients, it gets to be a lot, but having an organized report sheet is going to save your life. So if you're like me, you have to write absolutely everything down, otherwise it's not going to get done. And I finally come up with a way that kind of condenses all that information into an organized palette that I can then work off of and cross things off when I'm done, because I'm also super type A and I love crossing things off. So if you're looking for something that can kind of give you a overview in your entire day, you can hold up to 4 patients on one piece of paper. If you have 5, you kind of have to staple 2 together, and you get to cross a lot of things off, then this is for you. Okay, so here's the basic overview of my report sheet. I have a typed one that I actually use at work, but this is the same general idea. So on the top left, I'm going to put the date of today, and then on the right, I'm gonna put my phone number. So we have phones on my unit. If you have your pager number and you maybe switch those out, you could put that here. The next is gonna be the patient's name. I always do their last name first, followed by their first name, since that's how all the medical documents always have it. And I usually capitalize their last name just so it stands out a little bit more. On the right-hand side, I'm going to put their age and their gender. Below that, I'm going to put their diagnoses of why they are currently admitted to the hospital. So that's not going to include their past medical history. It's just going to include what is bringing them in this time and maybe what's keeping them here, depending on if it's been a long admission. Below that, I do the pertinent history. So this, if it's a complicated patient, isn't going to be, all 20 diagnoses that this person has acquired. I'm going to do the ones that are super important, surgeries that they've had recently that might affect their care, things that really stand out that I would want to remember. And then below that, I'm going to put the precautions that they're on while they're in the hospital. So that's going to be stuff like contact precautions, droplet precautions. I'll put when they got swabbed for whatever it was and what they swabbed positive for. That's also where I put seizure precautions and aspiration precautions. Next is the vital signs column chart at the top. I will cross that off when I've charted that patient's assessments. And then 9, 1, and 5 are when I get their vitals. Again, when I've gotten that patient's vitals at those times, I cross it off. Monitors are what's monitored on them. A cardiac monitor is CR, pulse ox is O2. I then am going to put their oxygen parameters or any vital signs parameters that are important to the patient. So if this one, it would be you need to give them some kind of medication if their systolic is over 120. Below that, I'm going to do how much oxygen they are on. This would be if they're on nasal cannula, CPAP, BiPAP, anything like that. And then what you want their oxygen percentage to stay above. So this one would be 90%. In the diet category, I'll put if they're NPO, what kind of diet they have, if they are eating. This would also be like tube feeds, what their tube feeds are running at and what their tube feeds are running through. This is a good place. I also usually put if they're on a fluid restriction, I'll put it in the diet category. The next column is going to be their IV, and that's where I put any lines or like IVs that they have. So PICC lines, peripherals, and I also put when everything was changed. So on here you can see it's a right double PICC, and then I usually do with, I put the lumens, so like G would be gray, and the gray has milrinone running through it, and the red is Heplocked. And then back down here, I always like to know when my caps were changed and when the dressings were changed. So I'll say that the gray cap was changed on a certain day and the dressing was changed on a certain day. I don't do when my lines were changed. I just look at that when I go into the room. Eyes and nose is the next column. This is one where I will put, what their total fluid goal is, if you're titrating fluids. I will also do if they are weight up or weight down. That's something that's important to my population since they're little. So, and I always like to know, what were they compared to yesterday? So in this case, they would be up 0.3 kilograms from yesterday. LDAs, all their line strains, I usually put here like their G tubes, their J tubes, their chest tubes. If they have a PCA, I would probably write that here. Anything that is sticking out of them that I would like to know, wound vacs, like JP drains, Penrose drains, anything like that. The star is just things of note that are a little bit different that I want to make sure to keep in mind and remind the next shift for sure what I have. So like this patient was tachycardic all day with the heart rate in the 130s to 140s. Their blood sugar was elevated. It's a nice place just for me to kind of jot down like these things were kind of weird. Also, if the team comes by, I can just look at this column and be like, hey, this is, their vitals. And a reminder to myself that they have a dressing twice a day. So just like a little chunk of, you should really know this. Drug calculation weight is next. That's their weight while they're here. Their last weight is next to it. That's less important for adults, but for kids, you always want to know what they were yesterday compared to their overall weight. Then I write out every hour that I'm going to be there. So, and this is going to be my legend for what I need to get done every hour. And as I go through, I'll cross it off, but I'll only cross off that hour when I've accomplished everything from it. So if I'm working a 12-hour shift, this is what it will look like. I circle the hours that I have med passes. I underline the hours that I have feedings or something to do with their food, and I star the hours when I have a task to do, such as a dressing change, a lab draw, anything that's time specific and a task. And then when I've done all of those and I've charted on that hour, I'll go through and I'll cross it off. So then I can keep track of what I'm up to date with. Next to that, I write all the fluids that they have going through their line. So that would be PCAs, any drips, any fluids. If you're working in an ICU, obviously it might look different because you might not have enough room right there. I usually can fit 4 to 5 drips going, and I work in a step-down unit. All right, below this, like my hair, I have a general info on the left, and then I have a to-do area on the right. So the general info area, I'm going to put things that are pertinent to the patient, but didn't need to be in that block up above. I start with their allergies, if they have any, and I usually underline it just so it stands out. I also usually highlight it in pink because why not? And if I know what the reaction is, I will include that as well. So here, like I said, I just put a ton of stuff about what the patient likes. Like, do they like watching The Lion King? Do they like it when, you play a certain type of music for them? What general preferences? You can put the phone number of a contact information there. You can do, this is how they ambulate the best. They prefer the bedside commode rather than going to the toilet. So just things like that. Sensitivity to narcotics, that's a good one to always know. Like, how do they react to all of those things? How do they prefer to take their medicine? Just general things that you would kind of want to know. You could also do their extended history here. Sometimes if it's a patient with a ton of medical history, I will include it over on that side. You also see I did PNPD Q2, so just kind of reminding myself that they get PNPD every 2 hours. On the to-dos, this is everything I need to do that wasn't included up on my hourly log. And some of it I even double do just to kind of clarify to myself below. So I need to write their care note. I need to feed them at 8, 11, 2, and 5. They have a bath at 10 a.m. We'll do a lab draw. So you can also see that these things down here have the stars up above. So it's a kind of a double reminder for me. Or it reminds me what on earth I have to do, because sometimes I write the stars and I totally forget what I was actually supposed to do. I also do notes I need to clarify with the team. If I need to document a neuro assessment every few hours, if I need to document like a PCA amount every few hours and a pain score, I'll write that down there. Pretty much if I don't write it down, I don't necessarily remember it. So I write everything down up there. And then below that, I usually do my second patient. So this sheet can hold up to 4 patients because you could do top and bottom, front and back. You could also do 1 page for like 1 patient if you had a ton to write. So that's the basic overview of my report sheet. You can tweak it however you want. Like I said before, I work on a pediatric floor. My sheet is kind of tweaked towards what I want to pay the most attention to in that population. However, there are a ton of different ways you can organize it. When I worked on an adult GI population, had a totally different focus than some of the things that I focus on in mine. If you work in an ICU, you're probably going to want to tweak it even more. You'll have less patients, so you could even take up that whole bottom half of the page with other information. You're going to have a lot more drips, lines, parameters, and PRNs that you're going to want to keep track of. So I would just put that down below. So yeah, that's not an exact thing to copy off of, but I hope it gives you some form of an idea of how to give an organized report, what a report sheet can do for you, and how it can help you organize your day. All right, if anybody has any questions or any ideas on what their favorite part of their report sheets are, let me know down in the comments, and we'll see you next time. Bye.